And now on the global square, Globala Torget, we will continue our focus on South Africa by actually visiting a South African book fair. We're going to Josie Book Fair, and in this arrangement between Afrikagrupperna and Josie Book Fair, we will meet community healthcare workers and talk about their victories in improving their working lives and conditions. They have also produced a book, so it's also focused on literature. And I would like to take the opportunity also to highlight a positive news that we got yesterday about the connections between Swedish and South African book fairs. As we do now, we have a focus on South Africa, but even next year, South African writers will attend the Swedish Book Fair. And 2022, the focus and theme of the whole book fair in Sweden will be South Africa, and also extended to 2023, where there will be a focus on children's literature and the connection between Swedish and South African literature. But now, over to Kenya College and the Josie Book Fair, and we will have the moderator, Dr. Maria van Driel, and she will talk to the authors of a book called Idonis and Doreen, Mongale. And the readers of their text will be Patricia, Makhubu and Andile, Ngema. And the book is called Our Lives, Our Communities. So welcome to this vibrant space of Joburg.
Good afternoon, everybody, and welcome to Josie Book Fair. Thank you very much for joining us. My name is Maria van Driel and I work for Kanya College. The Jozi Book Fair was formed in 2009 in response to the weak culture of reading and writing in all South Africa's languages, and really a reflection of the deep social inequalities that COVID-19 has once again confirmed. So we're a book fair that promotes movement building, solidarity and citizenship, and today we celebrate the victory of the community healthcare workers who are with us today. They have been precarious workers, etc. And what this affirms as well has been Jozi Book Fair's work with them as well over a number of years in different spheres. So with me today, I want to invite very quickly, and they will wave to you. We've got Idonis, who's the treasurer of the Community Healthcare Workers Forum. We've got Doreen Mongale, who is a former office bearer. We've got Patricia Makhubu, who is the current chairperson. And we've got Sisanda Kulima, who is an active member. So we will do two segments today. We will discuss the victory of the community healthcare workers, and then we will talk to the community healthcare workers as readers and writers in their own right. So welcome, and comrades, enjoy yourselves as well. Please relax and let's have this conversation. I think when we first met with community healthcare workers, they came to Kanya in 2010. They lacked a lot of confidence. They had a string of grievances, etc., in terms of not being paid, not having job security, not having medicine, not having equipment, and we realize how important PPEs are today. They also had no job security. They weren't covered by health and safety regulations. They also were not covered by the labor legislation. Since then, and of course, they were brought in 2010, particularly because of the HIV/AIDS pandemic. And because of the South African government's neoliberal program, many nursing colleges had been closed. And so women were brought in, Black women were brought in as community healthcare workers, as casual workers, as contract workers, etc., precarious, either working in clinics or attached to NGOs. And after many struggles, the community healthcare workers in 2016, we won a victory at the South African Labour Court, and Judge Benjamin deemed them as permanent employees of the Department of Health. The South African government's response, however, was to immediately outsource them to another NGO called Smart Purse. And so the struggle continues. In 2018, they managed to take the case again for arbitration to the South African Public Sector Bargaining Council. And once again, the Public Sector Bargaining Council confirmed that they are indeed members of, full permanent members, and should be treated as such with full benefits of the South African government. Once again, the South African government refused. And I must add here that if it was not for the pro bono support of lawyers and advocates, we would not have also been able to go that far, because although the community healthcare workers can talk about this today in terms of what were the methods that they used to actually get this. So it was only in 2020, this year, in July, that the community healthcare workers in Gauteng, one of the country's 9 provinces, right, have been made permanent with benefits, etc., medical aid, housing, subsidies, etc., and so forth. It's still a bit rocky because it hasn't all been done, smoothly. But I think to talk to us now about the long journey that they've traversed, I want to turn to Doreen. Comrade Doreen, can you talk a little bit about looking back at the lessons that you've learned as a community healthcare worker, as the Gauteng Forum? What did you actually learn when you think back now on this long struggle? It's taken almost 10 years to get to this point in time where these resolutions and legislation was eventually passed to recognize community healthcare workers, women workers, as permanent employees of the health department.
There are many lessons that I've learned about South African government One, it's ignorance to its citizens because they were ignorant when we engaged with them in many times trying to show them why would it be important for us to be permanent. And then we started by begging them, and then they still being ignorant to that. And then I've learned that our government doesn't even comply with its own law that is in their constitution. They didn't comply with their laws with us as community health workers, yet when they say we are frontliners of the department, but yet they couldn't practice the laws that if you volunteer for 3 months, after 3 months, you are permanent to the job that you've been doing. That has never happened to us till we fought and demand our permanent till this year in July.
Congratulations. Thanks, Comrade Doreen. Maybe if I can turn to Comrade Patricia, can you talk, Comrade Patricia, about how difficult it was, how you organized, how you had to change the attitudes of community healthcare workers, women workers. Many of them were single breadwinners, single parents as well, etc., scattered in different clinics. What methods did you use, as the Community Healthcare Forum to actually organize and to get to this point in time?
Good afternoon, Comrade Maria. Firstly, I would like to address the issue that as the Gauteng Community Healthcare Forum, we wanted to capitalize on the issue that we wanted people who wanted to stand up for themselves and voice out the issues and the challenges that they face in the household when they visit, and even voice out the patriarchy that they face in their household. In most cases, women are afraid to show up because they are mostly hiding behind men. So this was the platform, because mostly in our organization, it's mostly women who are dominating. So here we wanted everyone to be in a free platform to speak out and voice out everything that she's facing. Another thing that we went to the clinics, that's where we tried and mobilize everyone who was vocal, who was able to share each and every challenge that they have, and even try to be on the forefront, as we are called the forefront. It wasn't because of the money that we earned. The stipend didn't mean anything. Only the job that we were doing out of passion, that meant everything. So by so meaning that we meant the lives of the community that we serve, it matters mostly, other than having that stipend. But mostly what we were afraid of is that we were not treated well as the community healthcare workers by the employer. But we wanted that to be more realized, that we wanted to be at least treated fairly at work. Thank you.
Thanks, Patricia. I think perhaps, in 2017, the forum also then manages to form its organization, etc., and it takes these positions. One of the things that I think has also struck, that has been very different about community healthcare workers, is the fact that even though they never got their stipend during this period, they would still continue to go and do their work in the community. Now, this is very different to most trade unions and workers who go on strike, they withhold their labor, and they don't actually participate. We've even seen this amongst healthcare workers in some unions as well, yeah? Why was your response different? I mean, why, even though you didn't get, throughout the struggle as well, how come you didn't withhold your labor? You continue to work with communities. Can I ask Comrade Ida maybe to respond to this question? Can you unmute, Comrade Ida?
Yes, Comrade Maria, thank you. Even if we didn't get stipend, we fought for this community, that we forum, we are so unique to say we don't ban the resources that we have in our community, because we also involve the community that we are serving to help us to fight for health for all, so that everyone can get treatment and equally in their household, as we are doing as community health workers. So we didn't care about the stipend. We only really care about the passion that we have of our work to serve the community that we're staying in. That's all I can say that, Comrade. Thank you.
Okay, thanks, Comrade Ida. I think last, Comrade Tisanda, one of the things that is important with the community healthcare work is that you are 90% women, yeah? And what have the lessons that you've learned? Because one of your resolutions is that all positions in the forum must be 75% women. And I also want to ask you to maybe reflect on what is being, how did you cope as women with husbands or boyfriends who didn't want you to participate, who expected you to do household work, etc.? How do you see this position as women as well in terms of feminism, a mobilizing of other grassroots women in, because I think, as we know, in South Africa, we're still very, very far from, patriarchy is still very strong. Violence against women is still very strong in South Africa. Perhaps, Comrade Sisanda, you can reflect a little bit on that.
Afternoon, Comrade Maria. Thank you so much for the opportunity. Forum's vision is that all the CHWs must be able to stand for themselves. As we know that we are still living in a country where there is patriarchal systems in places, attached at home, also in workplaces. And then the forum, what it did is that we started to have workshops. We asked that we can have a workshop that will teach us on feminism. Then there was a feminist network that was established, where women are taught how to be able to be confident and go out there and fight and stand on their own. And in the workshops, we are also taught about patriarchy, and these workshops helped a lot in terms of the people that came to the workshop did teach the community care workers how to differentiate between everything. And then those people went back home and taught their families in their respected homes on what is feminism and what is patriarchy, and going forward, how are we going to deal with women having to be part of bigger making decisions and be able to stand their ground when it comes to other unfairness, which is in the workplace and at home also.
I also want to take this opportunity to invite viewers on Facebook and, to also send through any questions or comments that they might want to make in the interim. So how easy has this been actually now in terms of actually organizing? How many clinics do you actually organize in, Comrade Ida, more or less, if you can, talk to, your actual organizing strength?
More or less 213 clinics that we have now, which mostly are women in the struggle, and then mostly the breadwinners, though there are males there, but not most of them are working as community health workers. We're still organizing further because we are still exploring ourselves to Mpumalanga and Northwest. We still have, we have other members from those places that we are still we're still organizing them.
Okay. And Patricia, so what are the kinds of issues that you're coming up now against? Because this is a different phase of the forum's history and life. Now that you are, gaining so much more, are you gaining much more membership now that you are permanent as well?
For now, I could say that we're having a culture challenge because people now, they believe that they've reached the part of the struggle where they are done. Everything is now sorted. While we are still on probation, we're still gonna have to fight this probation thing, and the struggle still goes on. So we're having a big challenge because some of the comrades that we had last time, they are now moving to the unions, of which they believe that the unions are the ones who made this happen. While we were struggling on our own here, with, going down the streets. But now the unions, because they are in part of signage at the bargaining council, they believe that if we are not in the bargaining council, we can't do anything. But we managed to win each and every case that we had against the Department of Health, and we won it outside of the bargaining council. I also believe that the CHWs now, they are not in favor of this probation thing, but they'll come across with it.
I know you've picked up a little bit on this, Isanda, but I would also like Doreen to pick up on this because, you know, one of the things was the attitudes that I think, the change in attitudes for women, because when they came to Kanya in 2010, they had this long list of grievances that, Kanya, can you do this for us? Kanya, can you do that? And we were saying to the comrades, Kanya can assist you, but it's important for you to do this. And I know you say, you know, you've asked people to stand up for themselves, etc. But how easy was this in a country that is so patriarchal, in a society? Where were your allies? And I mean, how did you get support from other organizations? And how did you build the confidence of women?
I think the reason that has made us to become positive as women and realize that we will one day conquer what we want is that we were always checking on each other to say, let's do this thing. We will come up all right one day. And then that spirit of going out to another clinic, doing siasolas and road shows is that spirit that we were one spirit by that time. The unions were not giving us this difficult time because they told us bold that they couldn't assist us without a PESA. So everybody should understand that we can't be assisted, let us do it on our own. That's when we started getting a positive attitude from all women on the CHW level at all the clinics. So I think the positiveness in us has made them see that we really, really want to be permanent, as some of us were breadwinners, some of us were only women who were raising children alone. So they felt positive to join the struggle.
Thanks very much. I want to turn now to the last section of our discussion, and really it's to discuss the book, Our Lives, Our Communities, which is the story about 16 remarkable women who are community healthcare workers. The stories are very specific to their lives, but if you read their stories actually talk to the lives of Black working class women in South Africa. So let me turn to Comrade Ida and to Comrade Doreen as writers. Perhaps you can just read an extract for us and tell us, you know, what meaning and how reading and writing has helped you in your development as community healthcare workers and building a strong forum for women and for workers, and to what extent it's contributed to this victory that we have today. Shall we start with you, Comrade Ida?
Yes, Comrade Maria. I was born in Hamburg Hospital near Rodiport on the West Rand, but I was nearly resigned much later. I'm the third born in a family, and my mother was a domestic worker. My mother had to breastfeed her employees' children, and I stayed with my younger brother in a back house, and for a whole year, we were hiding away because my mother was not allowed to have her children with her while she's She is looking after employees' children. If my mother's employer found us, they will terminate her job eventually. Thank you.
Thanks, Comrade Ida. So how was it? I mean, you saw your story in print as well.
Yes, it's very, very, very much personal, because being a working class, and my mother also, you have to change. We have to change some to break the silence, to say to community, no, this has to end here, because no one can stop you to stand up and say, this is my chance to stand up and say, I want to be heard. I want people to change life from my story as I read my story.
Okay, thanks, Comrade Ida. Comrade Doreen, do you want to just read an extract from your story?
Yes, my name is Doreen Mongale. I was born in Bethel Dorong near Klerksdorp in the Northwest. My parents were Elizabeth Mongale and Isaac Mthobani. I only started attending primary at Temba Elisha in Randfontein when I was 9. I completed my matric in 2001, but I didn't pass well. I looked for a job, but there were no opportunities for women. I started working in 2002 as a domestic worker. When the opportunity arose, I started working as a CHW from 2006, and I had to report at Randfontein local municipality. And later in 2006, I moved and started working as a CHW in Coxworth Clinic, where we educate patient community about HIV and AIDS.
Thanks, Comrade Doreen. What was it like when you got your book for the first time as well?
When I got this book, I was very happy and nervous and emotional at the same time, because I never thought I would one day be an author of a book or a writer of a book. So it was very emotional for me to see that I made it, and it makes me feel very special.
Okay. Can I turn to, and I will probably give you, I think we still have a bit of time, to Sisanda and to Patricia. I mean, you were also readers as well. When you read this book as well about community healthcare workers, but also if you can just reflect on the importance of reading and writing for workers and for women who are struggling like yourselves around particular issues. Patricia, perhaps we can start with you.
Yes, ma'am, when I read the book, the first time I read it, it was somehow reflecting on myself and the issues that I've overcome and the challenges that all the CHWs are facing each and every day. Mostly the patriarchy that is happening on our household and the gender-based violence that we come across. It also highlights on how important it is to write and read so that you can be able to express yourself. We are very thankful that Kenya College was always there to help us do this, because in our workplace, we don't have some kind of debriefing and some kind of these sessions so that we can express our feelings on how we overcome each and every day that we face on our lives. And reading in our lives makes our intellectuality very, very boosted. And we must always be on a focus that we must always read and be focused. If you don't read, your life will never get better. You won't know anything. We are here because we read of our struggles. We are here because we are groomed. If we didn't do anything of those, we wouldn't be here as the CHWs. Thank you.
Thanks, Patricia. Sisanda, can I come to you with the same questions?
Yes, Comrade Maria. Getting to read the book our lives, our communities got us thinking and got us to see how far we have come, and to be able to see that it's not only me who's struggling with patriarchy, who's struggling with gender-based violence, like my colleague has said. Getting the book out there in the public was a form of recognition for us as community care workers. We saw that there are people who care to hear our stories. There are people who want to actually get in our shoes and see how we have lived. Even though the stories are not the same, the stories differ from each and every culture, but then they are the same as to what I experience is what Comrade Maria has experienced, what Comrade Doreen has experienced in a different angle. But the book has really made us to see that we are indeed one family, and we are indeed the people who love to work for our community. The strongest part that I've loved about the book is the commitment and the love that we had for our jobs. That's the most encouraging part that makes me smile.
I think that's true, and that runs throughout the book, because it was a very moving experience for me, who was working with you, to go through the book and so forth. And as you say, also you see how women change and transform, and they struggle and they rise and they hold all their children together, etc., and so forth. So I want to give you last few minutes now. I think you've all got just under a minute to maybe your last comments in terms of what advice you would give other community healthcare workers, but other precarious workers like yourself, you know, because there were days when things were so dark, when things seemed like we would, you know, you would never get success, etc. What advice would you give other workers, other women especially as well, who are facing struggles, either in communities, in workplaces, and so forth? What encouragement would you give them that you come out of in terms of the lessons that you've drawn from this experience? Who wants to go first? Doreen.
All I can say to add to fellow community health workers is that if you want to get something done, you must get it started. That's all I can say.
Thank you. Ida, nice and short, because you've got about 40 seconds, Ida.
I will say to comrades outside there, whether women and men, to say patience is a key to reach your destiny or to reach your goal. That's it. Thank you.
Thank you. Sisanda?
I would say that there is nothing about us without us.
Okay.
We the first step, then the rest will follow.
Okay, thank you. Patricia, last word.
I'd like to say they must just show up, represent and stand their grounds and show up, make sure that they stand for themselves and don't waste time and wait for others to represent themselves. Thank you.
Okay. One question, Patricia, you can just answer while you're on the floor. How would you help other CHWs overcome the challenge of unions taking your membership? In 30 seconds.
I think they should just learn to have the spirit of representing themselves other than waiting for others to represent themselves. That's the only thing I could say just now.
I think just to then for me to say thank you to everybody, Gothenburg Book Fair, the Global Square, our partner Africa Groupena, who stood with us and stands with us and is a very reliable partner. We really appreciate your support, and I think the people of Sweden and the people of South Africa, I think we need to really deepen our solidarity. It's been possible for the Jozi Book Fair to do the work that we do because of your support. We have not received any support from our own government for reading and writing, whether it's the Department of Arts and Culture or the Department of Education. I think it's been through our solidarity partners that we've been able to really help ourselves, that we are able to help community healthcare workers to help themselves to reach their goals. So I think it is absolutely important that solidarity is vested in people, the importance of people, the importance of citizenship, the importance of solidarity and building. And I think we look forward to working with the people of Sweden as well, and to strengthening solidarity from our side to help other CHWs in other provinces and other parts of the world. Thank you very much, everybody. And thank you very much, Gothenburg Book Fair and the Global Square and all the comrades. I think we more or less, we are really learning about keeping time. So thank you very, very much. And I think from our side, goodbye and solidarity.